Okay, so we're going to discuss today the chapter 2 all about the host microorganism interaction. So this topic will be discussing about the defense, both in the part of your microorganism or your bacteria and the defense as well here in part of the host. So for the defense of the host here, so we'll be talking about how our body were able to prevent or to eliminate the infection brought about here by our bacteria. On the other hand, we'll be discussing as well here the defense as well of the bacteria, how we're able to invade or able to evade the host immune system in order for that to grow or to prevent the microorganism bacteria to be killed by the host immune system. Okay, so first one, we have here the different relationship between your host and your microorganisms. So first one, we have here your symbiosis or your mutualism. Okay, symbiosis or mutualism is a relationship between the host, your bacteria, wherein both of them try to benefit from one another and both of them are not harmed or injured. Sample for that, we have here the relationship between your lactobacilli, which usually grow in the urogenital tract, like in the vagina of the female. The lactobacilli actually maintain the normal acidic pH of the vagina at pH 4 to 5. So if there will be disruption here in the pH of the vagina, pag naging alkaline ang vagina pH, it would make that one prone here to infection with other microorganisms. So therefore, the lactobacilli try to promote or try to maintain the normal pH of the vagina, which is acidic. On the other hand, so lactobacilli try to grow here inside the body of the host, the human. The human try to provide the nutrients necessary for the growth of your lactobacilli, and in return, the lactobacilli eventually try to help here maintain the vaginal pH. So that would eventually allow both parties to give benefit to one another, but each of them are not harmed or injured with their relationship. The second one, we have your commensalism. So commensalism, your relationship wherein only one benefit, but the other one is not harmed or injured. So example for that, we have the living together here of the human host, and we have your Proteus mirabilis. So even if you have Proteus mirabilis, it's not the one causing infection to the human. The third one, we have here the parasitism. So parasitism is a relationship wherein only one benefit and the other party, the host, most likely try to be harmed or injured. So there's a relationship between your parasite and the human. Okay, now we have here your indigenous microbial flora. Other name of your indigenous microbial flora is the usual, the normal microbial flora. So, pag sinabing indigenous microbial flora, that pertains here to the microorganism that try to be living usually normally in a specific part of your body. So, ito yung mga normal inhabitant natin. Mean to say your indigenous microbial flora are not causing infection. They are usually present on that area. So, they are not causing infection if they stay on that area lang, kung saan sila dapat or in-expect natin na mag-grow. Okay, so we have here the classification of your indigenous microbial flora based on the duration of your stay. So number one, we have your resident or frank. Okay, microbial flora. So basically, okay, that one is your, wait. Okay, that's your resident or your, oh, that's your resident. Okay, the resident here, microbial, indigenous microbial flora able to stay a particular part of your body for longer period of time. On the other hand, transient, so it would just have your temporary stay or just a short visit to a particular area, and most likely hindi sila nagsistay longer because they are usually being removed by the normal host defense, or it might be eventually being removed here because of the competition between your resident microbial flora. Nagko-compete sila for the space, for their growth, for nutritional requirement, and hindi kaya ni transient because again, transient lang siya. So, di ba? Bakit ka mga agaw pa? And therefore, that will allow it to stay only for a few or for a shorter period of time lang. Okay, then we have the term carrier. So, carriers are, is a medium or the try to transport facilitating the transmission of your infection. Your carrier could also be acute or chronic in terms of harboring the microorganism. So, acute carriers, they could be established here with your Staphylococcus aureus infection. So, like, Staphylococcus aureus could be found in your nose. So, pwede natin siyang matanggal to try to wash your nose, making that one as your acute carrier. On the other hand, the infection brought about here by your Salmonella typhi or your typhosa, okay, that one is try to cause here our typhoid fever. Okay, so it might, the patient infected by the Salmonella typhi, especially for those that who are not adequately treated, so you just expect here that the patient has already recovered from a disease or the infection. However, the Salmonella typhi inside the body of the host here are not completely killed and therefore able to stay. They try to take Inhabitant, okay, for a longer period of time, become chronic here on the bile duct of the patients. So, bali na-infect ang patient natin ng Salmonella typhi, may typhoid fever, naka-recover, gumaling ang patient, pero hindi mo lahat napatay ang Salmonella typhi. And therefore, try to stay on the bile ducts, and eventually that bacteria would eventually be passed out if you try to defecate. And what's going to happen here is that your fecal sample containing the bacteria is highly infectious. So, like if that fecal sample containing the bacteria gain entry to your water supply or even to your food sources, it could still cause an infection. So that become a chronic carrier state in the case of your Salmonella typhi. Okay, then we have here the factors which responsible here for determining what type of the organism could be found in particular part of your body. So the first one we have here your nutritional and environmental factors. So environmental factors, even nutrition here, the type and even the concentration of your nutrition will determine the type of what organism are going to grow in particular part of your body or what organism are going to inhabit a specific part of your body. So in terms of the environmental factors like moist area of your body, like your armpit, most likely that one is being inhabited here normally by our diphtheroids. Another one, we have resistant to the bile, to the lysozymes or the fatty acid. So just in the case, for example, your Propionibacterium acnes, so that one try to be living in the hair, in our hair follicles. Normally, your hair follicles would have fatty acid or lipids. Normally kasi ang fatty acid natin or lipids would have an antimicrobial property. So since may antimicrobial property siya, so it would kill your microorganisms that try to be found in your hair follicles. Except your Propionibacterium acnes na kaya niya mag-survive even in the presence of your fatty acid or your lipids. Generally, sa Propionibacterium acnes, okay, so hindi siya na-remove lang ng usual na taking a bath or you scrub your hair, hindi talaga siya nawawala. Okay, so basically, it's able to survive on that area even if you have high lipid concentration because it try to digest your lipids, converting that one to your fatty acid. And therefore, andun siya nakatira. Okay, but normally, wala kang makakitang microorganism or bacteria on that area of your body because again, of high content of the lipids. Because again, lipids is would have an antimicrobial property. Okay, now we have here the pH. In the case of the pH, so your vagina would have the lactobacillus that would enable that one to maintain the pH at an acidic pH 4 to 5 na pH. On the other hand, we have also here your breast milk versus your cow's milk. It would also determine here the different type of the composition of your bacteria. For your breast milk, most likely would have the pH of 5 to 5.5. That would allow the growth of your bifidobacterium. So, usually your breast milk, makikita tayo, makarecover tayo ng bifidobacterium because they're able to survive on that pH. But kung cow's milk ang ginagamit mo for feeding the baby, hindi ka makakita ng bifidobacterium kasi iba ang pH nun. Okay, then we have also here your oxidation reduction potential. So, decreased oxidation reduction usually found in our gingival crevices in your mouth area. And because of the decreased oxidation reduction, that would be ideal here for the growth of your Bacteroides and even your Fusobacterium. Another one, we have also here the diseases like, for example, your diabetes and alcoholism. So this would eventually allows the patient to be prone here to infection related to your gram-negative rad pneumonia. To try to cause the pneumonia. On the other hand, you could also have here your antibiotic treatment. Okay, so if you are taking antibiotic here, it would eventually try to kill the growth of the other bacteria, but at the same time, it allows the proliferation or it allows the multiplication of your Clostridium difficile. Okay, that one try to cause here your enterocolitis associated with your antibiotic treatment. So, pinapatay mo because of antibiotic treatment, but it will allow the growth of your other bacteria or other organisms like Clostridium difficile or your Candida albicans. Candida albicans is not a bacteria, it's a fungi. Okay, then we have here the usual flora at the body side. So, ano makikita natin na normally nakatira, okay, as a normal inhabitant in particular part of your body. The first one, the skin. The skin, usually, wala siyang microorganisms. Because your skin will have here the different mechanism here to prevent the growth of your bacteria. The first one, the skin would have mechanical barrier that would allow the contact here of your skin and your tissue with your microorganisms. Second one, your skin also contains here secretions like your lysozymes produced here by your sebaceous gland. So, meron siyang mga fatty acid that also help here prevent the growth of your bacteria. The third one, we have here the normal desquamation process. Pag sinabing desquamation, di ba yung mga kalyo natin or napipeel off ang skin natin, is just a normal process. And thus, desquamation is a process whereby is a way also of removing your bacteria. So, pag natanggal ang part ng mga keratinized skin natin, so, natatanggal din ang microorganism or bacteria. Okay, again, your skin, usually inhabited here, especially for the moist area. Mabasa-basa like your armpit, your groin, perineum, so mabaho din. Okay, so, most likely the moist area is being inhabited normally, makakita ka ng diphtheroids. Again, your hair follicles here would allow the growth of your Propionibacterium acnes because it's trying to resist the activity, antimicrobial activity of your fats or the lipid, or fats or the fatty acid or the lipids. Your outer area of your skin is normally inhabited here by your Staphylococcus epidermidis. So, normal flora natin ang Staph epidermidis sa skin natin. On the other hand, we have also here your mouth area. So, your buccal mucosa or your dental plaques usually inhabited here by your streptococci. Okay, the next one, we have your respiratory tract. So, respiratory tract divided here into your upper and the lower. The upper respiratory tract includes your mouth down to your oropharynx. Oropharynx here is your throat area. Then we have your nose. Nose is your external nares. Papasok doon das your nasopharynx, pababa das your larynx. So basically, this part of your body try to be inhabited normally by mga strep viridans. We have also your Moraxella, species of your Neisseria, and we have also your diphtheroids. In our nose, our nasopharynx, most likely we can find here your Staphylococcus aureus with your Haemophilus influenzae, Neisseria, meningitis, and we have also here your strep pneumonia. Okay, on the other hand, okay, the lower respiratory tract here would be including your lungs, bronchi, pulmonary, parenchyma considered to be sterile. Pag sabing sterile, dapat wala kang bacteria on that part. So, pag nagkaroon na bacteria on that part, that try to cause your infection. Okay, the next one, we have your gastrointestinal tract. So, this includes your esophagus down to your stomach. Okay, basically your esophagus here would have the presence of the small amount of your microorganisms that usually transient. Usually the microorganism that is being incorporated along with the food that you eat. Usually, di ba, pag kumakain tayo, so ang food natin contains the microorganism and that bumababa naman siya agad. And therefore, esophagus here would have the presence of transient na bacteria that is incorporated in the food that we are eating. Our stomach, on the other hand, this one is also sterile. Basically, because of the acidity of your stomach, because of your hydrochloric acid produced by your gastric juice or found in our gastric juice. And also contains several enzymes in your gastric juice that would be having that antimicrobial property. Except for your Helicobacter pylori, wherein that one could live within your stomach area. Small intestine, wala masyadong bacteria. Most likely, ang ating colon ang may madaming bacteria. Inhabited normally by our, okay, your strict anaerobes, your gram-negative rats or your gram-negative bacilli. This includes your mga enterobacteriaceae natin. Like what? Mga enterics, coliforms, E. coli, Escherichia coli, ating Klebsiella, mga ganang Shigella, Salmonella, and even your Pseudomonas could also be found normally in your colon. Okay, so automatic yan pag ang stool natin, we're expecting to have that gram-negative rods. Okay, so hindi siya nagkakos ng infection. If that, however, here nagkakos siya ng infection pag pumunta sa ibang part ng katawan natin. But normally, andun sila sa part na yon. Okay, this is your genito-urinary tract. That includes your kidneys, your bladder, fallopian tube are usually sterile. So, dapat wala tayong makikitang bacteria on that area. On the other hand, urethra. Urethra here is yung dadaanan ng ihi palabas. So, since medyo malapit na siya sa labas ng katawan natin, okay, bacteria found in that area usually coming from the skin, the outside surface. Kaya pumapasok siya because malapit siya sa labasan. The vagina, on the other hand, so this one is inhabited normally by our lactobacillus. And because of the one responsible here for the maintaining the normal acidic pH of the vagina. Okay, then we have here the role of your normal microbial flora. So, may advantages ang ating normal microbial flora. At the same time, also try to have the disadvantages. First one, we have here the role of your normal microbial flora in the prevention of the infections. But the first one, normal microbial flora here could help us in our body primarily by activating or priming our cells of our immune system. So because they are microorganisms here that would allow our body to be exposed to this different microorganism in our body since mga bacteria sila. So that will be recognized here by our host immune system and eventually try to activate, proliferate here our phagocytic system. Your phagocytic system here includes your PMN, polymorphonuclear neutrophil, simply your neutrophil, and we have also your macrophages. So again, they help here in order for them to become effective. So expose ka muna sa bacteria, which are your normal microbial flora that would allow your cells here that would help our body in the elimination of harmful pathogen here to eventually become effective. So it would activate your phagocytic system. Okay, another one. So once we are exposed also to different bacteria, microorganism here, like in the case of your normal microbial flora, it would also activate our body to produce your antibodies. And antibodies here would help our body in further eliminating and helping our body to eliminate those microorganisms with the use of your antibodies. Another one, your normal microbial flora also help you prevent the growth of your pathogenic bacteria. Primarily, they try to compete with your pathogenic bacteria with the space and even the nutrients in particular part of your body. Since normal microbial flora, ando na sila sa specific part of your body which are, they are normally inhabitant of that. So, pag may bagong bacteria which the pathogenic na bacteria, hindi na siya pwede mag-grow doon kasi wala nang space at wala na ring food masyado. Okay, so therefore, your normal microbial flora help here against the infectious diseases by the following mechanism. On the other hand, ito naman, okay, on the other hand, your normal microbial flora also try to help here also with the pathogenesis of your infectious agents. Okay, so number one, paano siya magiging disadvantage ang ating normal microbial flora? So in terms of nagiging infectious ito, ang ating normal microbial flora, try to cause a disease here if the specific part of your body where they are normally inhabited here by our normal microbial flora has been damaged, disturbed, or changed. Okay, like for example, nagkaroon ka ng tissue injury, nagkakaroon ka ng trauma in your particular, in your skin, for example here, ang mangyayari ay, ang ating normal microbial flora, they're able to spread to other part of your body. Pag pumunta sila sa other part of your body, which is normally hindi nila dapat lugar, so mangyari ay they try to cause a disease. Okay, so nagkakaroon tayo ng infection, like if they try to go different part of our body which are sterile. Okay, baka sila pumunta doon is because na damage ang kanilang normal area and eventually try to allow them to leak at pumunta sila sa other part of your body which are sterile or other parts of your body which normally hindi sila nakatira. And therefore, try to cause a disease if that happens. Okay, the second one, so your normal microbial flora also here become pathogenic or try to cause a disease. Okay, pag nag-weaken ang ating immune system, nagiging immunocompromised tayo. Okay, then we have here your microbial factors. So we have here the term pathogenesis. So pathogenicity or pathogenesis here is the ability of your organism to cause a disease in a susceptible host. So we classify your pathogen as your true pathogen or you call it your frank pathogen. So those are the pathogens which eventually can cause a disease, okay, even in a healthy na host. Okay, or immunocompetent na host. So kahit healthy ka, it try to cause a disease, then you call, once you are exposed or enter your body through the required na route of transmission or administration, then it try to cause a disease to your body even if you're healthy, then we consider that one as your true na pathogen. Example for that, your Yersinia pestis. So regardless of your immune status, kahit healthy ka, once exposed ka sa Yersinia pestis, try to cause here your plague. Then we have also here your Bacillus anthracis, try to cause here the anthrax. So we consider this one as your true pathogen because again, they try to cause here a disease even if you have an intact or healthy immune system. On the other hand, we have also your opportunistic na pathogens. So opportunistic pathogens are the microorganisms of bacteria that eventually try to cause a disease if you are not healthy, if your immune system are down-regulated or immunocompromised. So, hindi sila magkakause ng infection if you have healthy na immune system. Unlike dito, kahit healthy ang ating immune system, your true or your frank pathogen could still cause an infection. Dito naman, sa opportunistic, it try to cause a disease only if your immune system has been down-regulated or compromised. Okay, opportunistic pathogen here try to cause opportunistic infection or iatrogenic infection. Iatrogenic infection is infection here caused by medical treatment, medical procedure, medical devices, or even your organ transplantation. So like nag-undergo ka ng surgical operation, nagkasakit ka, or naglagay ng artificial devices sa katawan natin like your heart, processes or artificial heart valve, something like that, and nagkaroon ka ng infection with that, You call the infection here as iatrogenic infection. Example for that, we have your staph epidermidis. Ulit, ang ating staph epidermidis normally ay nasa skin natin. It's a normal microbial flora in our skin. But for some patient, which has been given here by artificial heart valve processes, so nagkakos sila ng infection doon sa device na yun na nilagay sa patient natin. And therefore, we consider staph epidermidis here as our opportunistic. And that's being caused here, causing iatrogenic infection only if you're being given an artificial medical devices. The same true with your Neisseria meningitidis. Again, normally, di ba, our Neisseria meningitis could be found in your upper respiratory tract. Okay, pero pag ang Neisseria meningitis mo ay pumunta sa meninges, it will cause your meningitis. Bakit siya pumunta sa meninges natin? It might be nagkaroon ka ng trauma or surgical operation, something like that, na nag-leak siya papunta sa ating meninges. From, saan siya makikita? Sa ating upper respiratory tract, your oropharynx, nasopharynx. So, dapat nandun lang siya. Pag pumunta siya doon sa meninges natin, it become pathogenic. It become opportunistic pathogen. Okay, then we have here the term virulence. Okay, virulence here is actually, okay, that's the relative ability of the organism to cause a disease. And that one is a degree of your pathogenicity. Okay, the virulence here of the organism here is highly dependent on the following. Number one, the amount of the inoculum. So, pag sinabing virulent, sobrang pathogenic, ganon. So, virulence is the degree of the pathogenicity. We have here the, okay, what determines here if your organism is virulent or not. So, number one, we have here the amount of your inoculum. So, the smaller the amount of the inoculum here, so the more virulent it is compared with the larger amount of your inoculum. What do you mean by that? So, okay, so like for example, if this organism number 1 require you to only have 10 lang na organism to cause a disease. So naman, kailangan mo ng 100. I mean to say, itong si smaller inoculum, pero nagkakause siya ng disease, is more virulent compared to the one na, so other organism here, sobrang dami mo kailangan na inoculum bago ka magkasakit. Another one would be the severity of the disease. Okay, so, slightly dependent here, so, okay, kahit kung minsan, di ba, kahit konti lang organism mo, pero ganun siya ka-severe ang disease niya. So, ganun siya ka-fatal ang kanyang disease. So, it's more virulent compared with other one na kahit konti naman siya, pero hindi ganun ka-severe ang kanyang manifestation, something like that. So, it's being measured by the amount of the inoculum plus, of course, the severity of the infection. Smaller the amount of inoculum, nagkakause siya ng disease. Smaller the amount plus the more severe ang kanyang manifestation, the more fatal it is ang kanyang manifestation, then is more virulent. Okay, we have here the different microbial virulence factors, primarily utilized by your bacteria to evade or to resist or to overcome the host immune system para hindi sila mapatay. And therefore, they were able to survive in the host and they can cause a disease. Well, the first one would be the ability of the organism here to resist the phagocytosis. So, pag sinabi naka-resist ng phagocytosis, hindi sila makilala ni phagocyte natin. And therefore, pag hindi makilala, hindi sila ma-eliminate sa katawan ni host. And therefore, hindi sila mapatay. Second one is their ability to adhere to the host tissues. Third one, the ability to survive intracellularly even after the phagocytosis. And the fourth one, they're able to release your enzymes or even toxins. Okay, that would help here causing more damage to the tissues of the host.